Welcome to the COVID-19 info session. Whether you're new to McGill, new to Montreal, or returning for your next semester, we have lots of helpful and important information for you. You may want to get a pen and paper or something you can take notes with during the presentation. My name is Ashley and I'm a nurse at the Student Wellness Hub. As nurses, we're there to help with and provide resources for physical and mental wellness to students at McGill. We're also involved in health promotion, vaccinations, and educational events on campus and virtually. During the live sessions, we will also have a peer health ambassador to share some links and answer some questions during the presentation. In this presentation, we will describe the basic info about COVID-19, identify preventative measures, discuss when and how to self-isolate, and where to access care. At the end, we will share some resources and answer some questions. Just a reminder that we're providing information based on the latest updates from our local public health authorities. However, the COVID-19 situation is unpredictable. We will update this information regularly to ensure the safety of our community. Let's start with the basics. COVID-19 is an infectious respiratory and sometimes gastrointestinal disease caused by a newly discovered coronavirus. Coronaviruses are a large group of viruses that can cause mild to severe illness in humans and animals. They're often associated with mild illnesses like the common cold in humans. COVID-19 is a new disease that had not been previously identified in humans, but spread from animals to humans and is now spreading from person to person. Two other coronaviruses that have spread from animals to humans and have caused severe illness are SARS-CoV and MERS-CoV. COVID-19 spreads through small droplets when a person coughs, sneezes, talks, or exhales. These droplets can land on objects or surfaces around the person or stay on their hands. You can catch COVID-19 by touching these objects or surfaces or by shaking the person's hand and then touching your eyes, nose, or mouth. However, this is not the main mode of transmission. We now know that breathing in these droplets from a person with COVID-19 is the main mode of transmission. Droplets can spread up to 2 meters when someone coughs or sneezes and can also travel when someone is speaking or exhaling. It can also be spread by kissing. This is why it's important to stay more than 2 meters away from other people. Some people can spread COVID even if they do not have symptoms, and these are called asymptomatic carriers. The onset of symptoms of COVID is gradual and normally starts 5 to 7 days after exposure, but can occur anywhere from 2 to 14 days after exposure. This is why it's necessary to isolate for 14 days and monitor for symptoms. The most common symptoms are fever, cough, shortness of breath, and difficulty breathing. Other possible symptoms include muscle aches and body pain, headaches, feeling more tired than usual, sore throat, congestion or runny nose, loss of taste or smell, and GI symptoms like nausea, vomiting, or diarrhea. Fever is one of the body's defense mechanisms to help fight infection. It's defined as greater than 38.0 degrees Celsius rectally in children and greater than 37.8 orally in adults. Acetaminophen, also called Tylenol, can reduce the fever and make you feel more comfortable unless you're allergic or a healthcare professional advises against it. It's a great idea to purchase a small thermometer or bring one with you from home to be able to accurately monitor your temperature. The Quebec government recommends writing down your daily temperature checks and monitoring for symptoms if you're under self-isolation. Now we'll talk about ways to protect yourself and others. Hand hygiene is important because it kills viruses and bacteria that may be on your hands. Regularly and thoroughly clean your hands with soap and water for at least 20 seconds. If you're out and about and not able to wash your hands, you can use an alcohol-based liquid, gel, or foam sanitizer with at least 70% alcohol, but make sure you use soap and water to wash your hands as soon as you're able to. On the next slide, I'll share a quick video on proper hand washing.
Hand washing should take you about 1 minute. Use a timer or count from 1 to 10 in each of the following steps. Wet hands with water and apply enough soap to cover all surfaces of the hands. Let the water run smoothly to avoid touching the tap later on. Rub hands palm to palm to obtain a good quantity of foam. Then rub right palm over the back of left hand with interlaced fingers, and vice versa. Rub again palm to palm with fingers interlaced. Rub the back of your fingers to opposing palms with fingers interlocked, repeating this action for each hand. Rub rotationally left thumb clasped in right palm, and vice versa. To clean the tips of the fingers, rub rotationally backwards and forwards with clasped fingers of right hand in left palm, and vice versa. Rinse hands thoroughly with running water. Dry hands thoroughly with a single-use towel. If the tap is not elbow operated, use this towel to turn off the tap without touching it directly. Your hands are now clean and safe.
You may have heard a lot in the news about social and physical distancing. You should maintain a distance of at least 2 meters between yourself and other people, regardless of whether they are symptomatic or not. This is to avoid inhaling or expelling droplets that may contain the virus. Remember that droplets can travel up to 2 meters when a person coughs, sneezes, talks, or exhales. If you're not able to maintain a 2-meter distance, you should wear a mask. Just because you're keeping a physical distance between yourself and other people doesn't mean you can't connect in other ways, such as phone, video chat, or online workshops. We'll have more info on this later in the presentation. Should you wear a mask? Yes, masks are now mandatory in all enclosed and partially enclosed indoor public spaces as of July 18th. This includes on the McGill campus. Masks are also mandatory in all public transportation. You can make your own reusable masks or purchase them online, but disposable face masks can only be used once. Face shields are not an appropriate substitute for a mask. Not everyone has symptoms, and wearing a mask can reduce the risk of an infected person unknowingly spreading COVID-19 to others. Masks, however, do not replace proper hand washing, physical distancing, or isolation at home. We will briefly walk through how to properly use a mask. First, make sure you wash your hands properly. Use one hand to place it over your mouth and the other hand to attach behind your ears. Adjust the mask to cover your nose, pinching to secure, and cover your chin by pulling the mask downwards. Wash your hands after putting on the mask and make sure you change your mask if it becomes moist, soiled, or damaged. Don't leave the mask on your chin or hanging from your ear or neck. Keep it on your face and avoid touching it as to not contaminate yourself. If you do touch your mask while wearing it, wash your hands thoroughly. When taking off your mask, remove it by the straps and avoid touching the front. Fold it with the outer parts together and store in a clean bag until you can wash it as soon as you get home. You can wash it with your regular laundry after each use. Avoid touching your eyes, nose, and mouth. Hands touch many surfaces and can pick up or transmit viruses that can make you or others sick. Hands can transfer the virus to and from your eyes, nose, and mouth. Surprisingly, most people touch their faces on average 20 times per hour. Follow good respiratory hygiene. This means covering your mouth and nose with your elbow or into a tissue when you cough or sneeze. Dispose of the used tissue and wash your hands immediately. Download the COVID Alert app on your smartphone. Built by Health Canada, this app will let you know if you've been in contact with someone who has tested positive. When someone tests positive for COVID-19, they will receive a one-time key to enter into the app. Without using their name, location, health information, or contacts, the app anonymously alerts people they have been in contact with that they have been exposed. The more people download the app, the more helpful it is in limiting the spread of COVID-19. For more information, search for COVID Alert on the App Store or visit the Government of Canada website. If you recently arrived in Montreal from another country, you are obligated to isolate for 14 days regardless of whether you have symptoms or not. This is required for travelers from anywhere outside of Canada, and you must have a quarantine plan to present to the border agent upon your arrival at the airport. If you recently arrived from another province, you're not required to self-isolate, but you must monitor for symptoms. If you develop symptoms, you must immediately self-isolate and call the COVID-19 hotline for further instructions. We'll talk about this hotline a bit later in the presentation. The Government of Canada is not currently recommending travel in between regions or outside of Quebec except for essential travel. If you plan on traveling or returning to your home country, some countries are requiring results of COVID-19 testing or medical certificates. Travel is not an indication for testing in Quebec, and tests are not covered by the government in these cases. The private labs listed on this page are recognized by the Laboratoire de Santé Publique du Québec and have agreed to carry out the tests and issue the certificates prescribed for travelers and nationals. For more information, check out the Government of Quebec website. We've been talking about self-isolation, but what does it entail? If you're self-isolating, you should stay at home for at least 14 days. Don't go to school, work, a childcare or daycare center, or any other public space. Do not use public transport and postpone all non-urgent medical appointments. Even if you and your family are self-isolating or you and some friends have been isolating, it's still not recommended and unsafe to have visitors or visit others. You can go out on your private balcony or yard, making sure you are 2 meters from any other person, but you may not go out for a walk. Those who do not self-isolate may face hefty fines and even prison time, according to the Quarantine Act. If you're self-isolating and you live with other people who are not required to self-isolate, make sure you wash your hands frequently and regularly clean high-touch surfaces. Remain alone in your own room, avoiding contact with others in the house and always maintaining a 2-meter distance. Cover your nose and mouth with a mask if you need to be closer than 2 meters from someone or when in the same room. If possible, use your own bathroom or disinfect the bathroom after each use. Avoid sharing any personal items like towels, clothing, dishes, and glasses. Avoid contact with pets, as pets are comparable to contaminated surfaces. You can air out your room by opening a window. The Government of Quebec has created an alert system which defines additional measures to be taken to ensure public safety. Montreal is currently in a red zone, which is the maximum alert. Make sure to check the Government of Quebec website frequently for any updates or changes. In our current situation, visitors from another address and private gatherings are prohibited. People who live in a red zone, such as Montreal, should avoid traveling to an orange, yellow, or green zone or outside of Quebec except for essential travel. Most post-secondary activities are provided through distance learning. Dining rooms, bars, theaters, cinemas, and museums are closed. Restaurants are open for delivery and takeout only. As the situation develops, these restrictions may change. For the most up-to-date information, check out Santé Montreal and the Government of Quebec websites. This holiday season, the government has outlined specific measures. Everyone should complete a voluntary confinement of 7 days from December 17th to 23rd. From December 24th to 27th, private gatherings limited to a maximum of 10 people are allowed. It is also recommended to limit the number of gatherings to 2. Different households should stay 2 meters apart throughout the gathering. Anyone who has COVID-19, who is isolating after coming in contact with COVID-19, or who has been tested and is awaiting a result, should not participate in gatherings. Starting December 28th, the government recommends an additional voluntary confinement of 7 days until January 3rd. In the next slides, we'll discuss what to do and where you can go if you feel unwell. If you're worried about COVID-19 and you have symptoms, you should call the COVID hotline at one of these numbers. 514-644-4545 is the number for the City of Montreal, and the 1877 number is throughout the province of Quebec. The other numbers can be called if you're in different areas of the city or province. After calling the COVID hotline, you'll be directed to the nearest COVID-19 screening clinic and to a hot clinic where you can be assessed by a nurse and/or doctor in person or by phone if necessary. Hot clinics are those where people with COVID symptoms are assessed. Screening is free even if you don't have the Quebec provincial insurance RAMQ, and RAMQ is not required to access a hot clinic. Visit the emergency room if you have difficulty breathing at rest or when lying down, persistent chest pain or pressure, confusion or inability to rouse, or bluish lips or face. If you're well enough, contact the COVID hotline and let them know if you have traveled and returned less than 14 days ago. You'll be told how to get to the hospital and what precautions to take. If your symptoms are severe and you are in distress, call 911. If you do not have symptoms of COVID-19 but think you may need to go to a hospital, you may still go to the ER or call 911 if you're in severe distress. The Student Wellness Hub has limited appointments on specific days to accommodate students who need an in-person assessment. We continue to provide telehealth services, and all students will need to have a telephone appointment prior to an in-person appointment. We are not accepting walk-ins. International students have access to Maple for telehealth services, and I will talk a bit about that service in a few slides. All cold clinics are generally not accepting walk-ins, so you will have to call ahead to make an appointment and maybe ask COVID-19 screening questions. Cold clinics are where those without COVID symptoms are assessed, and people are screened before coming to their appointments. Here are several clinics where you may be able to have an in-person assessment. More clinics are listed on the Student Wellness Hub website, along with clinics where you can have STI screening, IUD insertions, or PAP testing. Make sure to call ahead to make an appointment, as most places do not accept walk-ins at this time. You can also make appointments by calling 811. You can make appointments online at a clinic or for testing on Clic Santé. Rendez-vous Santé Quebec is for RAM queue holders to make appointments. Appointments can also be made with Bonjour Santé, but fees may apply to search for the clinics closest to you. If you're advised to self-isolate, you may need to report your situation to your Student Affairs office or department. If you begin to experience symptoms or test positive off campus and have not been on campus for the last 48 hours, you do not need to report your symptoms unless you require an accommodation for work or school. If you do need accommodations because you need to self-isolate or are too sick to study or work, you can use the self-declaration form online through Minerva. If you are a student employee and need accommodations for work, email disability.hr@mcgill.ca and inform your supervisor. If you live in residence and have COVID-19 symptoms, you should contact the COVID hotline for Montreal and call 514-398-3000 to report your symptoms to McGill. If you test positive, you can self-report on Minerva by completing the coronavirus self-reporting form. If you are a new resident student, contact student housing by emailing housing.residences@mcgill.ca to get more information on your housing assignment and quarantine plan to ensure that assistance is provided to you and services are maintained. If you aren't sure whether you need to report, visit the link above and complete the reporting process questionnaire to determine the appropriate steps to take. If you have tested positive or have COVID-19 symptoms and have not been tested, you can end your self-isolation 10 days after the onset of symptoms as long as the following conditions are met. You haven't had a fever in the last 48 hours without using medication for fever, and you have had no acute symptoms for 24 hours, except for cough and loss of sense of smell, which may last longer. If you've been in contact with a confirmed COVID case, you can end your self-isolation 14 days after your last contact with the confirmed case if you have not developed symptoms. If you do become symptomatic or test positive, you must follow the guidelines above and wait the additional 10 days from the onset of symptoms before ending self-isolation. If you have tested negative for COVID-19, a second test may be required to confirm. If you're not a contact of a confirmed case, waiting for a second test, or a traveler returning to Canada for less than 14 days, you can resume your usual activities if your state of health allows it. If you do not have any symptoms and are required to isolate upon arrival to Canada, you can end your isolation 14 days after your arrival, but you must continue to monitor for symptoms. Here are a few helpful resources if you're required to self-isolate. The Montreal COVID-19 Mutual Aid Mobilisation d'Entraide Facebook group is a place where anyone can post items or services that they need or can offer. This includes food deliveries, social support, legal and housing services, and wellness services. The Peer Support Center at McGill has now moved online and is offering 45-minute sessions virtually, where you can be listened to by a peer in a non-judgmental environment. The Quebec government has set up a COVID-19 legal aid clinic staffed by volunteer lawyers. It offers a free legal hotline for citizens who have questions about their rights and obligations in the context of the pandemic. There are several grocery stores that offer online shopping, such as Metro, IGA, Supermarché, Pia, and Provigo. Groceries can be delivered for a fee, or you can have a friend pick them up for you. Most grocery stores have toiletry items, cleaning supplies, and other household necessities available. Multi-CAF offers free delivery of food baskets to those affected by COVID-19. You can order by emailing them, and you can find more information by visiting their website. Single meal takeout and delivery can be ordered from Montreal restaurants through apps such as Uber Eats, DoorDash, Skip the Dishes, and A la carte Express, as well as directly from the restaurant. If you're experiencing stress or anxiety, you can contact the Info Social Service by dialing 811 to receive a psychosocial telephone consultation. They're answering calls 24/7. At McGill, we have virtual wellness programming and services to help you feel connected and supported. McGill.ca/COVID support links to virtual wellness activities such as online workshops, relaxation activities, and support groups. Some activities are drop-in and others require registration, so you can check the website for the most up-to-date activities and see how to sign up. Our programming is facilitated by mental health professionals at the Student Wellness Hub, which include counselors, access advisors, and local wellness advisors. Counselors are mental health professionals that try to understand the challenges you are facing and work with you to develop a personalized wellness plan. If you want to talk about an issue but aren't sure which hub professional is right for you, you can speak with an Access advisor. Access advisors are mental health professionals who provide clinical appointments to assess your specific needs and offer supportive interventions or redirect you to the most appropriate service. Appointments with both counselors and Access advisors can be made by calling the Student Wellness Hub. As part of the Student Wellness Hub's mental health support services, you also have access to local wellness advisors. LWAs are trained clinicians who can orient and connect you with the appropriate on or off-campus resource to address your unique situation. LWAs also offer wellness programming tailored to your particular faculty and work with departments on wellness awareness, prevention, and early intervention. For more information, please see www.mcgill.ca/LWA. Some examples of wellness resources and activities facilitated by these professionals that you can find online and do from home include Zen in 10, 10-minute mindfulness, meditation, or relaxation exercises facilitated by our local wellness advisors and Access advisors. These have been offered on the Student Services Facebook page since March 20th, and although we still have new sessions a couple of times a week, all of the previous sessions are still available for you to check out. Similarly, on the McGill Art Hive Facebook page, we have live art sessions facilitated by our artists in residence that anyone can access, and these are offered 3 times a week, no registration required. These activities represent many of the health promotion and resilience building activities from the Healthy Living Annex, a space for students dedicated to outreach, health promotion, and peer support. The HLA includes a team of dietitians, peer health ambassadors, the McGill Art Hive Initiative, McGill's Sexual Health Boutique, The Shag Shop, and various wellness workshops. As part of the Student Wellness Hub, the HLA has gone virtual since March, but is resuming some in-person activities, as well as maintaining the virtual ones throughout the semester, such as Zen in 10 and the Art Hive Live. For more information on the HLA, check out their website. The Healthy Living Annex's Peer Health Ambassadors are a team of student staff who promote health and wellness on campus and virtually, and are a great local resource during this time. The Peer Health Ambassadors are well-versed in topics including mental health, sexual health, harm reduction, nutrition, and more. They can help students navigate healthcare at McGill and direct students to on and off campus and virtual health and wellness resources. You can follow them and reach out to them via the Healthier McGill Facebook and Instagram. I would encourage you to check out the virtual hub, specifically mcgill.ca/COVID support, as previously mentioned, so that you can access all of our current and ongoing programming, which includes workshops like managing stress in uncertain times, cognitive behavioral therapy strategies for mood and anxiety, as well as support groups facilitated by the local wellness advisors for quarantined students. The website will be updated with workshops and groups in an ongoing way, so be sure to check in and register for those that would be of interest to you. In addition to Hub resources, Wellness Together Canada is a government-run service for mental health and substance use support, recently set up to help during the pandemic. They have call and text services available 24/7 so you can speak to someone about your mental health. Keep Me Safe is a mental health counseling service that specializes in student mental health support and provides unlimited access to licensed counselors through telephone and mobile chat with minimal wait times. Care is provided in over 60 languages and available 24/7, 365 days of the year. You can download the app on your smartphone by searching MySSP. It's a blue icon with white writing, and indicate that you're a McGill student when you sign up for your account. Suicide Action Montreal runs a crisis line 24/7 that you can call if you're feeling overwhelmed or having suicidal thoughts. As of March 13th, RAMQ now covers virtual and telehealth services, which includes telephone consultation with physicians. If you're an international student and have Blue Cross insurance, you have access to Maple to speak with a physician via video or phone chat. You can sign up through the link on the Student Wellness Hub website or by visiting getmaple.ca. Students from other provinces may also have access to other telehealth services depending on your provincial insurance. For example, students with insurance from BC, Alberta, or Ontario have access to TIA Health. Newly admitted and current students with financial concerns can apply to McGill's Scholarship and Student Aid Office for financial support. This is a bursary and loan program for students based on demonstrated financial need. To be considered for McGill Student Aid, you must have applied for and accepted the maximum amount of government aid or Indigenous band funding for which you're eligible. International students are eligible to apply, but only after their first 12 months of studies. This aid is tailored to individual circumstances, and advice and external resources will also be provided to students. Applications are on Minerva. Once you have submitted, the system prompts you to call or email for an appointment with a financial aid counselor. More information can be found on their website. If you would like more information on COVID-19, the best sites for up-to-date information are the McGill Coronavirus website, Santé Quebec, Health Canada, and Santé Montreal. We want to make Hub services and resources as accessible as possible to support students and build awareness of the Hub and its services, especially during this time. So over the summer, we worked on an updated rebranding of our Hub Instagram account, Healthier McGill. This is a go-to spot for Hub updates and resources so that we can continue to support students on a daily basis. If you have a question that wasn't answered today, be sure to check out Healthier McGill Facebook and Instagram pages. Thank you.